We, of course, just launched this today, and we're looking, as of this minute, for a CEO to lead the organization.
What really sold me on the West Wireless Health Institute was meeting Gary and Mary. Here are people who could have basically picked almost any charity, any area to try and make an impact in, and what they're trying to do is fundamentally change healthcare for the benefit of all Americans and, again, citizens of the world. And it's rare that you meet people who are that generous and who have that broad a vision. And one of the things that I'm excited about is the opportunity to match some of the skills I've been able to develop over the last 25 years with their vision and the passion to make a difference. So at the end of the day, how often do you get an opportunity where you meet people who have this level of commitment, this level of vision, and this level of passion about creating a totally new healthcare system for people? You can't sit with Gary for more than a half hour and not get the absolute passion that he's going to bring to this challenge. And given his track record of success in past lives, and you begin to see he wants to bring that same passion, that same excitement, the same energy to this next challenge, and I'm just proud to be part of it. So after a half hour, I was sold. For me, being the first CEO at West Wireless Health is an absolute honor. It means that I get to be on the ground floor when we set up our mission, we set up our strategy, we set up our prioritization, and we begin to set up how do we measure ourselves. We want to be an organization that's focused on outcomes. You know, a lot of activity is great, but at the end of the day, we want to measure ourselves as, did we make a difference? Did we impact people's lives? Did we develop new technologies? And ultimately, did we deliver cost-effective healthcare with superior outcomes? You know, it's interesting, when I was thinking about what next steps are appropriate for me, I've always said, how do I get involved in something that's transformative? How do you get involved in something that's focused on the patients? How do you get involved with something that's going to be growing and make an impact? And after spending time with Gary, Eric, and others, you really get the sense that this is going to be the place to be for the next generation of healthcare technology. Because if you think about it, look, today we do all our financial work on the computer. We do everything on our iPhones or a smartphone. That transition has not occurred in healthcare. One of the things is it is a new industry, so everyone has a different take on what we should be calling it. Basically, I think when you begin to refer to low-cost sensors that will somehow access the internet, get pushed through an algorithm and ask the patient to take action, or a provider to take action, or a caregiver to take action, that's all the same thing. And whether it's wireless health, M-health, mobile health is really not as important as what is the macro idea, which is low-cost sensors that take advantage of the ubiquitous nature of the telecommunications network today, as well as the ubiquitous nature of the internet, and provide a whole new healthcare delivery system. I believe the West Wireless Health Institute is absolutely at the foundation of this entire initiative. We're going to be one of the only places in the world that you can come and get great advice, whether it's technical advice, whether it's business model advice, whether it's regulatory advice, where you're going to have people totally committed to accelerating, innovating, advocating, and educating. So we believe that we're really going to be providing the glue that'll hold a lot of the early stage activity together. And then more importantly, once we begin to get a little bit of critical mass, how do we dramatically accelerate that critical mass so that in 5 years we're talking about an absolutely gigantic industry that's delivering significant patient value at lower costs. If I was to try and describe in one sentence what it means to be CEO right now, it's total excitement. It's rare that you get an opportunity to birth an industry with somebody who is creating a startup that is as well financed as Gary and Mary have generously endowed this foundation with as broad a mission, with as top-notch a team. So when you sit there, it's almost like you jumped into the seat of a Ferrari. You're about to start it up and take off because you know it's going to be a wild ride.